Good morning, everybody. It's Dr. Galvin with another post-night shift COVID update. Things are looking better in the ER. For the first time since the beginning of the summer, didn't have a completely full department. People were not waiting long. I actually saw 19 patients last night, which is the most I've seen in a long time because we've been so lacking in space and capacity to take care of people. Turned the department over to one of my partners this morning with really nobody waiting. It's the first time that's happened in ages. So things are looking up. We're still seeing a lot of COVID patients. They're almost 100% unimmunized, but far fewer than we've seen in the last few months. I think we finally kind of burned through the population. I'm Dr. Jeffrey Galvin. I'm a board certified emergency medicine physician. Been doing COVID reports since the beginning of the pandemic, and I give these updates after my emergency department shifts, and then we cover the other health related topics because I run a precision medicine, functional medicine clinic in Charlotte when I'm not doing this. Topic we're going to cover today is the newly announced oral pill for COVID. I think it's Merck that came out, and it's a Molnupiravir. I don't know how to pronounce it, but anyway, it's an oral pill. They did a clinical trial with pretty good results. They gave it to people that tested positive for COVID and developed mild to moderate symptoms. And in the trial that they did, 53. It was a placebo-controlled trial. So they gave one group, a pill that had the medicine in it. Other group, they gave an identical pill that just had sugar in it, and they followed both groups. The first group, the placebo group, had 377 participants. 53 of those ended up in the hospital, and 8 of those died. So about 14.1% of those people were hospitalized. In the treatment group, there were 385 people. Only 28 ended up in the hospital. No deaths. 7.3% reduction, or 7.3%. Hospitalized with severe disease. Basically dropped the risk of hospitalization and death by about 50% with this oral pill, which is, pretty great. However, remember, immunizations, Moderna drops your risk by 93% and Pfizer by 88%, and you never get COVID, or at least severe COVID, and you're not at risk for all that long COVID stuff, which we're going to talk about in just a minute. No idea how much it's going to cost. It'd be interesting to see. All those people are against, these emergency use vaccines seem to be dying for us to give them monoclonal antibiotics, which is an emergency use drug, and this is going to be an emergency use drug. And talk about big pharma. You don't think Merck isn't going to make a ton of money from these pills? I think the immunizations cost $20 or $30. You got to get 2 of them paid for by the government. I don't know what these will cost. Maybe they'll be generous and provide it inexpensively, but that's generally not the modus operandi of these companies, but we'll see. But again, pretty effective. The vaccines are way more effective. A little bit of long COVID information here. There's a study out of Wuhan, China, and they looked at, they had their cases basically a year, they have people that are, in 2020, who are out now over a year, and they studied 2,400 patients that had COVID way back between February 2020 and April of 2020, and they looked at them a year later. So, between February and April of 2021. And what they found was that 41.5% of the people that had mild to moderate symptoms still had one long COVID symptom a year later. And 54% of those that had severe cases had at least one long COVID symptom a year later. And there was a similar study out of Norway that showed 55% of people that had moderate to severe COVID had at least one post-COVID syndrome type symptom 6 months afterwards. So as I keep telling you, don't get COVID. Do everything you can to avoid it. That means washing your hands, wearing masks if you're going to be in a crowded place. Get immunized, please. Come on. At this point, 6.5 billion doses worldwide, no real problems at all. The major problem that we've seen with the vaccine is not getting it. And all these people that we're seeing in the hospital, all these people that have been admitted, all the people that we've seen die over the last few months and are continuing to die, the vast majority of them unimmunized. So please look after yourselves. Take care of yourselves. I'll be back soon with more updates. Stay safe. Good night.